Thanks, Paddy, and good morning, everyone. And I'd have to start by saying that listening to the stories that I've just heard this morning, I actually feel sick in the stomach. And I'm feeling really shaky, and it's because of that, because I'm quite sure that there are several people here in this room who've been the victims of what we've been hearing about. Good, honest, caring health professionals, doctors, nurses, whatever vein you're in. And it actually makes me feel ashamed that these people, you people, who are held with such high esteem in our society are being treated like this. And so I guess that Jason and I, our hope today is that together we can all work together as consumers, as parents, as health professionals to bring about the change that's needed to make this a more positive workplace and healthcare system for us all. So basically the reason that Jason and I are here this morning is to put forward what happens to patients and their families when doctors and health professionals are being treated in the ways that we've just been hearing. Because the reality is that when their doctors are bullied, patients and their families become the victims too. And they are put through the most enormous and ridiculous procedures just trying to get the care that they need for the sick people of their family. And when that sick person is a young child and they're being made the scapegoats for what is going on between doctors, then I think that's about as low as it can get. And so that's why I'm prompted to be here this morning and delighted to be able to team up with Jason, because this is what we want to do. We just want to shine the spotlight on how the APRA complaint system is not protecting the patients. The very reason that it's set up, that it's established for, it's not doing its job. It's not protecting the patients, and in fact, it's actually allowing the patients and their families to be used and abused when they get caught up in doctor disputes, and their pain and suffering can linger on for years. And the impact that that has not only on the patients, but on the parents, on the other siblings in the family, it's astronomical. As we've heard the impact that it has on doctors and their families when they're caught up in this, well, the patients, the members of the public are caught up in it too, and that's why I'm keen to be here to try and be the voice of the public and supporting you in trying to bring about this change. So actually, I'll take that one back because I want to hide that one for a minute. Basically, I need to explain my background and how I got involved. I'm not a patient, and I'm not the parent of a patient. I'm just a concerned member of the public who became aware of what was happening to patients when they were caught up in these matters. Now, for several years, I've been the supporter of some self-help groups for families with sick children, and we raise funds, and obviously we meet together, obviously at fundraising functions, and we always chat, and I'm always asking people, how's your little boy, how's your daughter, what's happening with them? And it was only after several years of meeting parents and gradually hearing their frustration that they couldn't get the treatment here in Australia that their sick children needed, that I just thought, there's something wrong here. This isn't right. And I guess what really spurred me is the fact that 45 years ago, I brought home from hospital a baby girl who was sick every day of her life. And by the time she was 3 years old, she'd stopped breathing many times. We'd nearly lost her several times and been to every doctor we could think of. And finally, we were referred to a paediatrician who examined the case, treated us all with great care and compassion, and said that he felt that the only way forward was to perform a surgery that wasn't really well accepted for children of her age. However, he explained the risks, the complications, gave us time to go away, think about the decision, and together my husband and I agreed with the doctor that this would be the best way forward for any improved quality of life. So we were able to make that shared decision together. And we were so grateful when we had that choice, because now she's a 45-year-old, fit and healthy, active mother of 2 young men, and in fact just last week was awarded an award for her outstanding contribution to women's water polo. And as you know, water polo is not an easy game, and this was a young child that couldn't even walk halfway up a small street without collapsing on the ground, and now she's one of the fittest members of our family. But we were given that choice, And I'm horrified to think that parents are being denied that choice now, and certain doctors are taking over this role of making decisions about who can and who can't. So there were two stories in particular that fired me up. One is the story of a beautiful young baby boy called Cooper, and you're going to hear his story very shortly from his dad. The second was the story of a young man, 12 years old, and for today's purposes we'll call him Max. And Max was suffering from an enlarged bowel, and as you can imagine how difficult that would be for a young man to manage. I've spent all of my life working in schools as an educator, and for the last 20 years as a school counsellor in an all-boys school. And I've had the experience of other young people who've had a similar medical condition, and it's absolutely a nightmare for them to try and manage. They live in fear every day of having an accident, of being ridiculed. They're excluded from so many activities because they can't go to sport, they can't go on excursions, school camps, because there's not going to be any toilet close by. So when this young man was being denied the surgery that he could have had here because of all of this doctor disputes going on, his parents had to take him overseas, travel 8,000 kilometres, so that the Melbourne surgeon of the family's choice could operate on their son. And I thought, this is just an indictment on what is happening in our medical system, and it needs to be changed. So that's the reason I've now become extremely passionate about trying to do whatever we can to bring about such change. As I said, the other story that I heard when I met this dad on the dance floor at a function, and I said to him, "How's your little boy?" And I saw the tears well up in his eyes. And nobody can tell his story better than he can. So let's welcome Jason. Thanks, Jason.
Good morning, how is everyone? Hopefully everyone's well. I've been asked to present to you today about my story. It's a 4.5-year story. Started June 2011. We attempted to get medical assistance for our boy who had a medical condition. He was then 6 months of age. We were referred by our GP to a hospital. That hospital advised us that it wasn't urgent. We had to wait 6 months. We didn't accept that, of course. We then sourced another referral, which we'll call Specialist A. He was diagnosed and completed all relevant tests at that given stage with Specialist A. We spoke in depth with Specialist A about all the options, and we knew exactly what was going on and what was going to happen. We decided at this stage this was the right course of action for Cooper. So we got booked into a private hospital, and the operation was cancelled by the hospital. We then sought approval for a local hospital to us, and we're all booked in, all ready to go. Received the phone call at I think it was approximately 2:30 p.m. to say, be in at the hospital 7:45 a.m, start getting him prepped, start getting him ready. 6:30 p.m. that night, received a phone call from the Specialist A. The operation was cancelled. 6:30 the night before, after getting him prepped. Upon receiving this information, we decided to go to another specialist. We'll call Specialist B. Specialist B spoke to us and advised us that the operation that was advised by Specialist A, that no one in Australia would do this treatment for Cooper. So we took his recommendation of what he wanted to do. On the day of his operation, it was cancelled. Cooper had a wheeze on his chest, and we accepted that. We have to be safe, we know that, and that was the right decision. Upon cancellation, my wife and her mother were called into Specialist B's rooms, and they were told that that he was going to notify Specialist A to the medical board for his recommendation. Also told my wife that she would have to give evidence against the original specialist, and made my wife feel very uncomfortable and fearful. Upon leaving, we decided that we would not go back to Specialist B due to his poor behaviour and making my wife feel extremely threatened. The notification had gone through, and I received a phone call from APRA in relation to our situation, and where I advised very clearly, unequivocally, that we supported Specialist A in his advice and treatment option for Cooper. We even wrote a letter to APRA advising of this, yet they still decided to move forward with this notification by sending it to the Immediate Action Committee. In the meantime, we had seen 3 other specialists, 2 in Melbourne and 1 in Canberra, for further assistance. I made contact with several other organisations, one being the Ombudsman's Office, National Ombudsman's Office, to see if this behaviour towards not only our family, but also the specialist of our choice, could be investigated. I sent that email on January 25, 2013. For whatever reason, we never received responses after follow-up emails to the office until April 22, 2015. That's correct. 2 years to get a measly response that was, shall I say, passing the buck in relation to this whole saga. 2 years. So I'll go back to January 17, 2013. I was personally involved in the Immediate Action Committee meeting with Specialist A in his support for his actions for Cooper. Upon being introduced, the IOC was shocked, to say the least. They ran for their iPads and writing pads, as they now knew who I was, the father of the boy concerned. However, to my amazement, they did not let me speak at all. Even after the IOC asked the lawyers if they had feedback from parents about Specialist A, the lawyers then told the committee that I was the parent and to ask me. They declined me the opportunity to speak about this item at all, even though it was pertinent to the reasons why I personally was there. After 2 hours of questioning, it only took 5 minutes of deliberating for them not to take this action and notification any further. If only APRA had listened to the family in the first place, it would have been solved a lot earlier with a lot less stress for all the parties involved. Yes, but that's their job, unfortunately. By the end of 2013, I'd also seen 3 other specialists, as I said, 2 in Melbourne, 1 in Canberra. They had scorned at the option of Specialist A, and a hospital had also done part of the operation recommended by Specialist A, had recommended only part. So by 2014, the part operation was unsuccessful. Cooper was still in pain, and with no other options, I contacted the CEO of the hospital in an attempt to get a meeting with all the specialists involved in the care of Cooper, excluding Specialist B. I must make that note. They agreed to it, but the meeting was only to involve their 3 specialists, not any other externally of the hospital, even though I had requested it. I met with their team in October 2014, and an agreement to conduct 2 last tests before they would complete the original operation that was recommended by Specialist A in 2012. In March 2015, the operation was completed. Surprise, surprise, he's pain-free. My recommendation to the medical fraternity is to first listen to parents if there is a complaint. They are the ones that have the information that is accurate and is not biased on professional personal opinions. If they would have done this with my family, this would have been resolved quickly instead of having to fight the system for nearly 4 years. Turned us upside down, and more importantly, Cooper not having to go through all the pain for nearly 4 years. So I'm going to tell you a little story now. I'd like everyone to close their eyes, please, if you wouldn't mind. You wake up at 6 a.m. You get ready for work. You have a shower, say goodbye to your family, walk out the door, drive an hour to work. You do a whole day's work. You're taking phone calls from medical people, taking phone calls from APRA. You just want a normal life. You work all day, you're dealing with customers, you're dealing with staff, you're managing people like nothing's happening in the background. You then get home from work and you just sit down and you have your dinner. And whilst you're having your dinner, you try and find your son who's left the table for unknown reasons. And then all of a sudden you find him, and you find him like this. That's everyday occurrence. That's what he was experiencing every day. As you can see, this was taken a month ago. Fine young man now, 5 years of age, fighting fit, no issues, apart from a couple of psychological ones from the 4.5 years of torment. So I now ask yourself, why did the people that have the power not to listen to the family, and in doing so put them through hell and high water in relation to this? Ask yourself that question. Why did they do it? So my recommendation, and it's a personal recommendation, is that instead of letting people personal vendettas towards colleagues in the medical fraternity, whether you call it bullying and or harassment, actually do what is required for patients to make it a patient-centred system. I honestly thank you for the opportunity to speak today. I hope that you, as a collective, can make the system change for the better, so that we can stop harassment, not only of doctors, but also families, and stop it from tearing them apart, like mine, that was directly affected by other practitioners being so aggressive towards one individual. I thank you for your time today.
Thank you, Jason, and it's a pretty heartbreaking story. We've gone back one. Oh, we seem to have lost one. Okay, but we'll go on from here. So as Jason said, basically what he has done and what so many of us as members of the public have done, have gone through all the channels, all the letter writing to the medical board. No response. To APRA. No response. To the Ombudsman. No response. Actually, I have to admit there was a response. We got an acknowledgement. Thank you for your letter. This is a private matter. There'll be no further communication. Door shut. One more time. Where do you go? What do parents do? What do members of the community do? Clearly, the system has failed us, is failing us, and needs to change. When Victoria announced a parliamentary inquiry into the performance of APRA, once again, we wrote letters, we made submissions, we attended. And one of the key, this is actually my letter, I think, and one of the key recommendations I put forward there was that independent mediation needed to be the first step before it became a battle between lawyers. Because, as Jason said, if only APRA had sat down with the family and listened to them, that little boy would have been free of his pain so much quicker. So currently there is a bill, actually it's being read for the second time in Parliament, I think sometime this month, the new Health Complaints Bill, and it has actually put forward some very solid recommendations, a lot of the things that we've been hearing today that doctors are seeking and that patients are seeking. And whilst it hasn't been finally approved yet, I think we're very hopeful that it will be. And we're actually suggesting that perhaps people should get a look at this, because it could provide information for the new model for APRA, where it is really focusing on making patients, listening to patients and making patient-centred care the focus that it needs to be. So these are the recommendations that we would put forward, that this is what needs to happen. Patients should be listened to and involved at every stage. Patients' choice and rights should be respected. Mediation should be a first step. Complaints should be responded to in a timely manner. The process needs to be accountable to independent oversight, and perhaps in developing whatever recommendations we put forward, that we might look at the new Victorian Health Complaints Bill. So we're just hoping that together, patients, members of the community, doctors, members of all the medical professions, that we can work together to bring about reform so that it's a much better system for both patients and practitioners. Thanks for listening.